Assalamu alaikum, dear all students, my dear friends. This is Mir Asif, and you are watching A&I Study Hub. Today, we'll have a basic concept about cardiovascular system. Let me tell you what is cardiovascular system. Cardiovascular system is actually a transport system which transports nutrients towards the body tissues, which transports hormones towards the body tissues, which transports antibodies towards the body tissues. Not only it transports the nutrients, hormones and antibodies towards the body tissues, but also it takes away the metabolic wastes from the tissues and drains it into the cable system. Okay, so cardiovascular system is a transport system which is supposed to transport hormones, which is supposed to transport nutrients, which is supposed to transport antibodies, and which removes metabolic wastes from tissues into the cable system. Okay, so first we'll discuss about the normal position of the heart. Okay, let me rub it. So normally heart lies in the thoracic cavity. Okay, normal position of the heart is called levocardia. Levocardia means when the apex of the heart is towards the left side of the sternum, and dextrocardia when heart is towards the right side of your sternum. This is the bone prominent area. This is called a sternum. And when your heart lies towards the left side of the sternum, or apex is at the left side of the sternum, that's called a levocardia. And when your heart is towards the right side of your sternum, that condition is called a dextrocardia. Levocardia means when apex of the heart is towards left to the sternum. And dextrocardia, second condition is dextrocardia. Dextrocardia means when heart is towards left side of the sternum. When heart is towards the left side of the sternum, then there are different terms. One is cytosolitis and situs inversus. Cytosolitis means when all the body parts, thoracic organs and abdominal organs are in a normal position, and inversus means when these organs are not in a normal position. Suppose they will look like a mirror image in inversus. Suppose normally this is the sternum and heart lies towards the left side of the sternum. And normally stomach is towards the left side, and liver is towards the right side of your abdomen. okay, in right parasternal region. So this is the normal structures. This condition is called situs solitis. Situs solitis. Situs solitis levocardia. Then what is situs solitis levocardia? Situs solitis levocardia. Situs solitis levocardia, when all the body parts are in a normal position and heart is towards the left side of the sternum. So that condition is called situs solitis levocardia. Understood? Then second condition is situs inversus levocardia. Situs inversus levocardia. Levocardia means when heart is towards the right side of your sternum, and levo inversus means when these body parts will look like a mirror image. Stomach will be towards right side and liver will be towards left side. So that condition is called situs inversus. Situs inversus means when body parts are not in a normal position. Situs inversus levocardia, but heart will be in a normal position. Situs inversus levocardia. Situs solitis levocardia, that is a normal position of the heart. Solitis levocardia. Then what is situs solitis dextrocardia? Situs solitis dextrocardia. Situs solitis dextrocardia. Solitis means when body parts are in a normal position. This is your spleen, this is your stomach, and this is your liver. Okay? But dextrocardia means when heart is towards the left side of your sternum. Okay? So this condition is called situs solitis dextrocardia. Situs solitis dextrocardia. But what is situs inversus dextrocardia? Well, dextrocardia, heart will be in the same position, right towards the sternum. But inversus means stomach will be towards the right, liver will be towards the left, spleen will be towards the right. Okay, that will be like a mirror image. So this condition is called situs, yes, you repeat with me, situs inversus dextrocardia. Situs inversus dextrocardia. I hope you all understood. Once again, I will repeat it. Situs solitis. Situs solitis means when body parts are in a normal position, and levocardia means when heart is towards the left of sternum. Situs inversus levocardia, but when body parts are not in a normal position but heart is in a normal position. What is situs solitis dextrocardia? Situs solitis dextrocardia means heart will be towards the right side of your sternum. Heart will be towards right side of your sternum, but organs are situs solitis dextrocardia. Heart will be towards the right side of your sternum, but your body parts, abdominal organs and thoracic organs are in a normal position. Situs inversus dextrocardia. Situs inversus dextrocardia, when thoracic organs and abdominal organs are not in a normal position and heart will be towards the right side of your sternum. Okay, I hope you understood. I will rub it now. Now we'll move towards the structure of the heart. Towards the structure of the heart. First of all, I'll make a very basic structure of the heart, very basic or very simple diagram of the heart. Suppose this is a heart. It's more funnier. This is a very basic structure of the heart. Okay. Heart, there are four chambers of heart. There are four chambers of heart. There are two upper atria which are superiorly and two ventricles which are inferiorly. Upper cavities are called atria, and the structures which is below the valves, these are called below the atria, these are called ventricles. Okay, and in between there is this valve like structure with this, which is in between right, this is right atrium and this is left atrium. Okay, this is right ventricle and this is left ventricle. Okay, so in between right atrium and right ventricle there is a valve. This valve is called a tricuspid valve. Tricuspid valve. And in between left atrium and left ventricle there is a valve. Let me make it with the different colors so that it will be visible to you. This valve is called mitral valve, or this valve is also called bicuspid valve. Bicuspid valve. Okay, so this tricuspid valve allows the blood from right atrium to right ventricle, and this bicuspid or mitral valve allows blood from left atrium to left ventricle. So these valves are also called input valves. What are these valves also called? These valves are also called input valves. Input valves. What are input valves? Tricuspid valve and mitral or bicuspid valve. Okay, so these are input valves. So these input valves allow the blood from right atrium to right ventricle. From the left side, it allows from left atrium to left ventricle. But these are also called AV valves. These are also called AV valves. Why? Because they are in between atria and ventricles. Atrioventricular valves. These are also called AV valves. And there are two more valves. Those are outflow valves. Those are outflow valves. Let me make more clear diagram so that it will be clear. Let me rub it first. First of all, I will draw left heart here. I will draw left heart here, and you should tell me what is this structure. This is left atrium. This is left atrium. And what is this? Left atrium, and this is left ventricle. And in between left atrium and left ventricle, which valve is there? Yes, please. I will make it different color. There is bicuspid valve. Okay, so this is input valve. I will draw a right side of the heart. Okay, right side of the heart, this is right atrium and this is right ventricle. Okay, and in between right atrium and right ventricle, which valve is there? Tricuspid valve. Okay, why we are calling this tricuspid valve and bicuspid valve? Because this tricuspid valve is having three cusps or three leaflets, 1, 2 and 3, and this is called a bicuspid valve because this is only having two cusps, one cusp and the second cusp. Okay, so these are also called AV valves, these are also called input valves. Okay, so now what are outflow valves? Outflow valves are in between right ventricle and pulmonary artery or the lungs. The another valve in between left ventricle and the aorta or the systemic circulation. The valve which is in between right ventricle and the pulmonary system, that valve is called yes please, pulmonary valve. And the valve which is in between left ventricle and the aorta, that valve is called yes, aortic valve. Okay, so two inflow valves, mitral valve and tricuspid valve, two outflow valves, pulmonary valve and aortic valve. Okay, I hope this is clear to you. So I will repeat it again. Normally the caval blood, venous blood will be drained through the superior vena cava and inferior vena cava. Superior vena cava will take the venous blood from the superior part of the body and inferior vena cava will take the blood from the lower extremities and it will drain into right atrium. Then from the right ventricle, the blood will be pumped into right ventricle through which valve? Tricuspid valve. Then right ventricle will eject blood or it will push blood into pulmonary system. This is your lungs. Okay, right ventricle will pump blood into lungs. Okay, through which valve? Pulmonary valve. Then lungs, this blood will be oxygenated or it will get oxygenated into lungs. Then from each lung, two pulmonary veins will come out from each lung. How many? Yes, two. There is 1, 2, 3, 4. So 4 pulmonary veins will drain into left atrium, but it will drain oxygenated blood into the left atrium. Okay. Then from left atrium, it will pump blood into left ventricle. Through which valve? Bicuspid valve or mitral valve. Then from left ventricle, it will eject the blood into aorta. it will eject blood into aorta through which valve? Aortic valve. Okay, then from aorta it will perfuse the rest of the body. Okay, so I hope this is clear to you. Now we have discussed up to now the chambers which is superiorly, those are called atrias, and the chambers which are inferiorly, those are called ventricles. And we have discussed about the AV valves or input valves, and we have discussed about outflow valves, or those are also called semilunar valves. Okay, let me make a simple diagram one more here. Okay, this is tricuspid valve and this is mitral valve. Okay, this is superior vena cava and this is inferior vena cava, and this is right atrium, right ventricle, left atrium, left ventricle. Okay, so now there is a structure which will divide the two atrias, and the two ventricles. That structure is called a interatrial septum, which is in between two atrias. Okay, interatrial septum, that is a barrier in between two atrias. Interatrial septum is in between right atrium and left atrium, and interventricular septum is in between two ventricles, right ventricle and left ventricle. Okay, now this was the basic structure. Now we have discussed about the chambers, we have discussed about the AV valves and outflow valves. Now we have to discuss about the layers of the heart. Layers of the heart. Layers of the heart. There are three layers. There are three layers of the heart. One is endocardium. The second one is myocardium. And the third one is epicardium. Epicardium or serous pericardium. Serous pericardium. Okay, endocardium, which is the most inner layer of the heart, Suppose I will draw a left heart here. Endocardium, suppose this is your histology of the heart. I will teach in next lecture. So now, for now, you should know layers, then I will teach you the histology and the cellular diagram of the endocardium, myocardium and pericardium. Okay, suppose this is the inner layer, this is endocardium, and then second layer is myocardium. Second layer is myocardium. And the third layer is epicardium or serous pericardium. Okay, this is, I will make it in a different color so that it will be clear. serous pericardium, okay, or epicardium. Then there is pericardium, okay. One is serous layer. There are two layers of pericardium. Pericardium lies outside the heart, okay. So pericardium is having two layers. One is serous pericardium, which is also called epicardium, and the outer layer is called parietal pericardium. Parietal pericardial layer. Serous pericardial layer and parietal pericardial layer. The space in between two, serous pericardial layer and parietal pericardial layer, is called a pericardial space, okay. Pericardial space. The space in between serous pericardial layer and parietal pericardial layer is called a pericardial space. So this is pericardial space, okay. In this space there is a fluid. Normally there is a fluid present in pericardial space. That fluid is called a pericardial fluid. Pericardial fluid, which is normally present around 50 to 55 ml. Everybody has understood? If anybody is having questions, you can drop the question in a comment section box, or if you have any topics, suppose if you have doubts regarding any topic, you can comment me in the comment section box, so that I will try to upload next on that particular topic. Till that, Allah Hafiz.